Well, hello and welcome to today's episode of Breaking the Taboo. And we're already on series 3, and today's episode has come about from listener questions. We do read all the comments that you send in to us on Instagram and TikTok and through our website, and pre-eclampsia was one of the topics which we've been asked many times about by you as listeners. So I'm delighted to have with me today 2 guests to talk about pre-eclampsia. And the first is Andrew Shennan, who is Professor of Maternal and Fetal Health and Head of the Department for Women and Children at the King's College London. He's also based at St Thomas's Hospital, and he's the chairman of the charity Action on Pre-eclampsia and a founder of APAC International. He specialises in preventing preterm births and pre-eclampsia, and also advises on reduction of maternal and perinatal mortality in low and middle income settings. And he's advised the House of Lords, NHS England, FIGO and the World Health Organization. And he was awarded an OBE for services to maternity care and is a fellow of the Academy of Medical Sciences. So welcome, Andrew. And I'm delighted to also be joined by my second guest, who is Abbie Harris, who is Education and Operations Manager at Action on Pre-eclampsia. And she's the primary contact for helpline calls and as the organisation's designated mental health first aider. And she's been part of the charity since 2022. And in 2017, Abbie herself developed severe pre-eclampsia and gave birth to her son Jude prematurely at 24 weeks and 5 days. And very sadly, Jude survived for just 32 days in neonatal care. And that's something we'll talk about a bit later in the episode. And she shared her heartbreaking experience to help raise awareness of pre-eclampsia. But I'm glad to say that she's also now a devoted mum to her vibrant 6-year-old daughter. So thank you both so much for joining us on today's episode. And to be honest, pre-eclampsia was not something I knew a huge amount about when I was pregnant with my daughter. And I came across it first when another mum in my NCT class did suffer from pre-eclampsia and had to go into hospital. So I'm so pleased that we have some time today to talk in a bit more detail about what it is and to help other families who are dealing with this. So Andrew, perhaps if we could start with the more basic question to kick us off. So what exactly is pre-eclampsia and what does that mean for the woman and her baby?
Well, Theo, first of all, thank you for inviting us to come and talk. It's a real opportunity to share what I think is a really important issue, simply because the knowledge of pre-eclampsia can make a huge difference in terms of dealing with it and understanding it and preventing problems in the future. So this is a great opportunity and we're delighted. And I think one of the things you said about not knowing what it was is incredibly common. Most women actually have very little idea and concept about what it is or even have heard of it. And so I think it's great to be able to have this discussion today. It's a condition which has been around forever and people get it still. So it hasn't got less. It affects, say, in the UK, about 1 in 20 women. That's a huge number of women each year. And I think the key thing about it is that as long as you know about it, and you detect it and manage it, it's incredibly safe and nothing to worry about. However, the downside is if you don't know about it or if you miss it, it can be incredibly dangerous. Indeed, it can be fatal, both to mother and baby. And I think this is beautifully illustrated by the fact that it still happens everywhere in the world. And in some places, the outcomes are incredibly good, like the UK at the moment, and in other places they are devastating. And because it hasn't gone away, and because it's still there, and because tomorrow you could get it, it's really important people understand what it is, what you have to do about it. So to answer your question, what is it? We don't fully understand, but it's manifest by having high blood pressure, and that's why it's critical that every pregnant woman gets their blood pressure measured. It's not just high blood pressure. If you can have high blood pressure and it can be relatively innocent, it's not a good thing to have for many years, but it's not like critical. Whereas high blood pressure in pregnancy can be critical. And then what it may reflect is another disease going on inside your body, which affects the whole body. And the way we detect it is by measuring the blood pressure, because that's a relatively easy thing to do, and by checking the urine, because again, that's a relatively non-invasive, easy thing to do. And you would leak protein in the urine and you will have raised blood pressure. And that tells you something bad is going on. It's actually reflecting a multi-system disease, we call, that can affect the placenta and the baby, as well as all parts of the mother. Therefore, what it means to the mother and baby is that you need to know about it. And one of the problems is, for half the women, they feel nothing, that you feel completely well. You even may have no symptoms whatsoever. There are some clues. There are sometimes you get headaches and visual disturbance or indigestion type symptoms. You might even get excessive swelling, but those things are quite common in normal pregnancy as well. So they're not that good at telling you exactly if you have it. And hence, if you have those things, why you need to have the blood pressure and urine checks. Once you have it, though, you've got to do something about it. And it may be increased monitoring, and it may be other things which we can talk about. But it's a disease that's in the whole world. Internationally, it kills tens of thousands of women every year. It kills 500,000 babies a year. What's really important is we manage it well.
Well, that's so incredibly helpful. And I was struck there, Andrew, about your point that some mums won't feel any different. So actually what you're saying is it's incredibly important to have regular checks during pregnancy to pick up any of these issues. So Abbie, did you exhibit any symptoms? How did you first know that you had preeclampsia?
Kind of like what Andy was saying in regards to I felt relatively fine. It was my first pregnancy my first viable pregnancy. I'd had miscarriages beforehand, but this was my first viable pregnancy, so everything was new. So I was a bit swollen around my ankles. I'd been on holiday in Spain as well, around 20 weeks, so it was very hot. It was August. So that kind of swelling wasn't that worrying because it was kind of, oh, this is probably what pregnancy is like. This is what I hear a lot of. My only other symptom, which is the symptom that ended up making me go into hospital, was that I just had this headache, quite a very frontal headache that I couldn't get rid of. And obviously when you're pregnant, you can only really take paracetamol, which I did. And I had some baths and I drank a lot of water, but I just couldn't shift it. So that's what made me ring into triage. And yeah, they weren't too worried to start with because my blood pressure was relatively normal. I would say it was kind of on the high end for me, but if someone else was looking at it, it just wasn't that high as a standard blood pressure. So I think that's quite an important point to make, is that you need to be aware of what's normal for you, because then what's a high blood pressure for you might be a little bit different for other people. But yeah, so my only symptoms really were the swelling and a headache, but generally I felt quite well.
So I think it's a really important point for anyone listening today to understand. So Andrew, could you just say what are some of the symptoms then that mums listening today should be looking out for, which is something they should take seriously and get checked out?
I mean, I think it's worth just stressing, as Abbie says, is that you can be completely well, so you can't rely on symptoms and signs to tell you you're well. Hence the need for the extra checks when you're pregnant and the blood pressure checks, the urine checks. That said, there are some classic symptoms, and Abbie's actually illustrated a couple of them. One of them is headache. The other is blurred vision, and you can also get a bit of nausea and sickness, and vomiting may be associated with it. And also an indigestion pain, so sort of discomfort, actually just over the liver, underneath the ribs, towards the right. Those things may be common just because you've got indigestion or because you've bit dehydrated or whatever. So the thing is, if they are different and persistent, it's particularly important that you seek advice. But there's no harm in just getting your blood pressure checked if you had those symptoms, because if it's very normal and you have no protein, there's really nothing to worry about. And about half the women who get very sick have no symptoms at all. So you can even have, a crisis that is life-threatening and feel completely well. So again, don't rely on the symptoms, although if you have got them, it's a really good marker to say, go for a quicker check, go and see your midwife, go and see your GP, go to the hospital a bit sooner, don't ignore it.
And that's something we talked about on our previous episode and so many times on the show, is how important it is to ask for help. And I've had so many mums writing in to say that they didn't think to advocate for themselves or to ask the question. I hope that anyone listening today, this is the point of breaking the taboo by speaking about these subjects, is to get you access to the help and resources that you need. So Andrew, can I just ask, is there anything that women can do then to kind of reduce the risk that they might have of getting preeclampsia?
Yeah, and although we've said clearly that anyone can get preeclampsia, and unfortunately, even if you are the healthiest person and done all the right things in the world, it's still possible to get it. There are certain underlying factors associated with preeclampsia, which I guess on a public health level, it's important people are aware of that. So we know that mothers, as they get older, sometimes very young mothers, teenagers, are more at risk. If you have more than one baby, like twins or triplets, there's a definitely increased risk. If it's in the family, so if your sister or your mother has had it, those are quite strong risk factors. Now, obviously, you can't do everything about risk factors, but I do think you can make choices. And, the IVF doctors, for example, are less likely to put back twins now because it may increase risks like preeclampsia. And obviously, an ideal weight is always a good idea. You don't have to be a size 10. I mean, you just need to be going the right way and be fit and healthy, and that will also help. And one thing that's quite important is between pregnancies, try not put on weight, because we know, especially if you've had a problem, that will reduce your risk. So they're kind of behavioral issues, but a lot of it is just the way you are, genetics, and there's nothing you can do about it. I think there are some treatments. So, for example, if you've had preeclampsia before, there's a higher risk of having it again. And under those circumstances, one can take some simple, very safe therapies like low-dose aspirin that won't guarantee you can't get it, but it'll reduce the risk or make the chance of it being severe better. So those behavioral issues and seeking advice, is also a good thing.
Well, that's really helpful advice. And for anyone listening to today's episode, we will have a lot of show notes in the bottom of iTunes and Spotify, where you can find links to a lot of the resources that will be discussed in today's episode. And Abbie, if we could just go back to your experience. So you said you didn't have really any knowledge of preeclampsia before it happened to you. Could you just talk a bit about when you did see that you had signs of something going wrong with the swelling? What was the next step? So when you entered into the health service, what were the resources that you were provided with?
Yes, so my first port of call was to ring my GP, actually. So I went to the doctors because it was my first pregnancy. It wasn't a high risk pregnancy. I didn't have any high risk factors. So it's not like I was seeing my midwife regularly. I think I'd already had my 20-week scan. So I probably wasn't going to be seen till like 30 weeks or something like that. It was a long way off my next appointment anyway. So I went to see my GP and he did my blood pressure. And I just remember the bottom number being like 107, which was high. I would usually be around like 60 or 70 for the bottom number. So that was quite high for me. And he did seem to look worried and he dipped my urine. And I think there was maybe a trace of protein at that point. So he advised for me to go into triage, but that I was safe enough to drive myself in and just that they would recheck. I don't think he actually mentioned preeclampsia, but he just said that he was a bit worried that my blood pressure was high and that I had swelling. At that point, I didn't really have much of a headache. It was just more the swelling I was inquiring about. So I drove myself to the hospital, which was like about half an hour away from my doctor's. And they rechecked my blood pressure. And I remember them saying actually that they were quite upset with the doctor because the doctor had used like an electrical monitor rather than a pump up monitor, which the midwives like to use. So I think they were kind of querying the validity of my result to start with. And by the time they did it, it had gone below 100, that bottom number, so was less at risk. They checked my wee as well, and I think, again, there was just a trace of protein. And I think they also did some blood tests at that point, but it all came back as normal. So I was kind of just sent home to keep an eye on my symptoms and monitor myself, which I did. And then the headache kind of came in thick and fast then. So I rang up triage on the evening that I had a bad headache. They said, take some paracetamol, have a bath, drink a little bit, and then ring back if you're not feeling any better. And I did. I was like, it just doesn't feel right. Something feels off. This feels very different to any other headache I've experienced. And I wasn't really satisfied. And I'd had like pregnancy loss beforehand. So I think maybe I was just a little bit extra cautious as well, a little bit anxious about the whole thing. So I decided to call back and kind of say to them I'd really like to come in and get checked, which I did. So I went into our local hospital, to the triage centre, and they put me on monitoring to see baby's heartbeat. Baby's heartbeat was absolutely fine. I hadn't felt any movements yet because I was only 24 weeks at this point, and I had an anterior placenta, and it was my first pregnancy, so I hadn't felt anything. So when they were asking me, have you got any reduced movements, I was like, I don't know. I think then when they were keeping an eye on my blood pressure, and it was kind of just around 90, sometimes going into the hundreds, sometimes not. So I wasn't started on any hypertensives. They checked my protein, and it came back with lots of things this time. So it had protein, but it also had other things in, like nitrates and blood, I think. So they thought that maybe there was a urine infection going on. But I'd experienced urine infections before as a woman, they're quite common, and was like, this isn't it. I'm having no symptoms of any kind of pain. This does not feel like a urine infection. I think something more sinister is going on. So I kind of advocated for myself as much as I could at the time, but also, trusted that they were doing the right things. They were doing what they call PET bloods, which, Andy, correct me if I'm wrong, I think they were looking at like my liver function and my kidney function. And they were, as far as I'm aware, were coming back normal. I was consultant led for that pregnancy because I'd had 3 miscarriages beforehand, but I had only seen my consultant once at this point, and it was basically just like, you're fine until you're not. And she happened to be on call that evening and just poked her head around the door. She was about to finish her shift, and she said, oh, I just saw your name. I saw that you're in. What you doing here? And I was like, oh, I've got a bit of high blood pressure. I'm a bit swollen. And she looked at my notes, and she looked at the other consultant that was in the room with me, and she said, I think we need to send her to labour and delivery.
Wow.
And I was like, what? That changed? Because the consultant that was on the call that night, he was happy to send me home because he said, you only live half an hour away. If you go home and then you come back in the morning to have your blood pressure taken again. So I was getting ready to leave when that other consultant came in, my consultant, and said, we need to wheel her around. And they put me in a wheelchair, which I remember thinking, like, I'm fine. Why am I in a wheelchair? I've just got a headache. And I went round to labour and delivery, and my consultant, she scanned me at the bedside, and they were measuring him, and I didn't know it was a him at this time. I was trying to have a surprise. And I just remember them like measuring a part of him. I think it was his femur, and I could see on the screen it said 22 weeks and 2 days or something like that. And I was like, well, that's not right, because I'm like 24 weeks and 3 days. That doesn't make sense. And I said that to her, and she was like, just give me a moment whilst I, finish what I'm doing, and then I'll explain to you what's happened. And before she explained to me, she got some doctors to get some steroids. She got someone to put a cannula in to start magnesium sulfate. And then she said, look, your blood flow to the placenta, Andy will be able to explain this much better, but essentially it'd gone absent, which meant that he wasn't growing. And it wasn't going to get any better, and that baby would need to be delivered pretty imminently, which obviously terrified me because I was like, well, he can't come now because he won't survive if he comes now. She reassured me that because I was actually, even though like I was at over 24 weeks, even though he was measuring below that, but because I was past 24 weeks, it was classed as a viable pregnancy. Therefore, they would try and resuscitate. But I also knew that I couldn't have him there because they just don't have the services there. They needed to transfer me to a more capable hospital. And the closest one they had that had a bed for him and a bed for me was 3.5 hours away in the ambulance. So I had my first lot of steroids and my first lot of magnesium sulfate. I believe the steroids are to help baby's lungs develop a little bit more, and the magnesium sulfate was to kind of protect baby's brain and protect my brain from any seizures that could happen throughout the preeclampsia. The word preeclampsia also hadn't really been said at this point either. I think I was then just more concentrating on the fact that he was obviously very little and that he would need to be delivered. And I think I also had to do like a 24-hour urine thing. So every time I went to the toilet, I had to do it in a jug. But yes, that's how I found out. That was my experience with the hospital up until obviously moving to a different hospital.
Yeah, and we can get on to talk a bit about having a premature baby in a moment. But Andrew, just more on the kind of medical science aspect, could you just explain what Abbie was just describing there about the baby not receiving the proper nutrients through the placenta? So what's actually happening in this scenario from a medical perspective?
Sure. So we know that preeclampsia affects the whole body, and that includes the placenta, which the baby relies on for everything from getting oxygen through to food. The placenta basically fails and the baby stops growing. So the baby will get sicker and sicker. And you may not know about this. Even if the mother feels completely well, and even if the mother has very mild disease, the baby can have severe disease. So it's really important, if you have preeclampsia, that you scan the baby and check out these things. So Abbie gave a very typical story where people weren't that worried about her, but actually the baby was in jeopardy. And we have to do those extra checks to find that out. And equally, the mother can be very sick and the baby can be fine. So basically, it's a failing placenta. And as Abbie has said, we have to check the whole body. So you do get these kidney checks and the liver checks, and it can affect your blood, it can affect your brain, it can affect everything. And if you leave it unchecked and undelivered, then any one of those things can actually kill mothers. So you can get rupture of the liver, you can get abnormal clotting, the placenta can come off, what we call an abruption, which is incredibly dangerous for both mother and baby because you get severe bleeding. So there are lots of very devastating things that can happen if you don't deliver the mother, which is why that had to happen. So I think in summary, if you got preeclampsia, it's only a matter of time before either mother or baby dies unless you deliver it. And delivering is the key thing. The treatments you get, like treating the blood pressure or drugs to stop fitting, are not there to make it go away. They're there just to keep it stable while you're organising the delivery or waiting for the baby to mature a bit.
Wow, well, that's pretty sobering to hear how incredibly serious it is. And as you said, can be life-threatening. And Abbie, presumably this was much earlier in your pregnancy than you were expecting to be told, your baby's about to arrive. Would you mind sharing very bravely your kind of personal story about what happened to Jude?
Yes, so I got transferred to a hospital in Liverpool. And it was kind of like a watch and wait. They had said it probably would be within a few days because once the flow has gone absent, it's not going to go back positive. They were I think they were waiting for the blood flow to go reverse. So the plan was to scan me in the mornings, and see, like, make a plan of the day from whatever the results of that scan was. So I'd had one set of steroids in my home hospital. The next morning, I think I had the next set because you get two loads. I had a conversation with the neonatal doctors as well. They'd come to see me. That gave me a little bit of hope as well, because in my head, I just thought, well, I don't need to talk to them because he's probably not going to be able to come out breathing. So, I don't really need to talk to them. But actually having a conversation with them gave me hope, but also gave me like realistic expectations, I suppose. I had worst case scenario in my head because that's kind of just how I think anyway, unfortunately. You can't prepare yourself, obviously, but that's kind of what I had told myself was going to happen in the very near future. The first morning, the scan was fine. I think blood flow was still just absent, but no emergency to get him out. And then it was the second morning that it had gone reverse. So they said, like, we're going to have to give you a cesarean today. I wasn't allowed to birth vaginally because it would be too risky for the baby because he was so small. So to give him the best chance, it was to do a cesarean. It's what they call a classical cesarean, where they cut you up and down on your uterus and then across on the outside. I believe they do that for premature babies and for quite big babies as well. I think it gives them some more space to get baby out. But it also means that you can never labour. So that was kind of taken away. And there was like some paperwork that I had to sign that was like, you will have to have a cesarean if you ever have another baby. But obviously in that moment, that didn't mean anything to me because I was like, well, I'm not having another one because this is horrific. They started me on magnesium. So I was wheeled down to like delivery, and they started me again on magnesium sulfate. And he kept getting monitored. And there's the strangest experience to feel like, one, I felt relatively well in myself. And two, I could hear his heartbeat and it was absolutely fine. So I was like, why? Why is he having to come out? I'm fine. And, to my naivety, I'm like, he's fine because he's breathing and his heart's beating. It felt very abnormal to think that he should come out when obviously to me, he felt like he was safer in, but obviously knowing everything I know now, he was actually better out than he was in, because he would have only eventually have passed away, or I would have obviously got severely ill as well. So it would have been either one of us, if not both. So I was waiting for my emergency cesarean, and lots of emergencies happened before me, so it was quite a long wait. I think my scan was at like 7 o'clock in the morning, but he wasn't actually born till like 4:30 in the afternoon. So it was a very anxious wait. The cesarean went as planned. They told me that they weren't sure whether they'd be able to actually intubate him, get the breathing tube down his throat, because he would have been the smallest that they've had. So gestation-wise, they had had 24-weekers before. I think they'd even had a 23-weeker, but they hadn't had someone as small as him. And when he was born, he was 495 grams. So he was a very, very, very tiny baby. And they told me he was a boy once he came out. So we got that nice little surprise. And I heard what I can only describe as like a little baby bird. Made like a little baby bird noise. And that was him crying. Which actually, once I've now read his notes, he was crying because they'd already tried to intubate a few times and it failed. They'd said like vocal cords were heard, which meant that it hadn't worked. But I think they said about 7 minutes and they managed to intubate. And I remember them wheeled him past me, and because with premature babies they try and like emulate the womb, the incubator that he was in was obviously really steamed up. It was very humid in there. And I couldn't see him at all. I don't know whether maybe I didn't have my glasses on or whether it was just so steamed up, but they were like, "Can you see him?" I was like, "No." And they were like really in a rush to like obviously get him down to neonatal. And I was like, "I can't see him." And in the end, I just lied and was like, "Yeah, I've seen him," so that they could get him down into neonatal. It's also a good point to know, if you have an emergency cesarean, there's like 50 people in the room.
Yeah.
There was a lot of people in the room, and they did all introduce themselves and said what they were there for. But obviously, I wasn't really there in that moment. But I think it was quite a shock to see how many professionals that were in the room at the time.
Well, firstly, I'm really sorry to hear about your experience. And I think something I've heard from so many mums on this podcast is when their birth experience has not gone to plan. And as you were saying, like not getting to hold your baby and spending those first precious hours with you, that's like your whole expectations have been completely subverted. But perhaps, Andrew, if I could bring you in, have there been any more sort of advances in sort of medicine's understanding or about how to manage preeclampsia sort of more recently in the NHS?
Yes, I mean, I think Abbie's illustrated some really phenomenal examples, of which unfortunately are only too common in the NHS. The key thing about preeclampsia is to make sure you know you have it. And to be fair on the people who look after you, it can be very tricky to know whether it's severe or not. And I think she was saying how one doctor was ready to send you home and the other was saying, this is serious, you've got to be delivered. So that question of do you genuinely have it is a critical one. And in fact, the only reason Abbie was probably picked up was because a doctor happened to know her name and cared about her from a previous event. So a lot of people go missed in this situation, and they will go home, their baby will die, and that could have been avoidable. And I know poor old Abbie's outcome may not have been different, but at least she was safe having been delivered. So the key thing is to know you have it. And one of the real advances that we've had in recent years is a new test that is very reliable. So until now, we've just taken blood tests to see if your kidneys are damaged or your liver's damaged or whatever. Now we actually have a test of the placenta that tells you if you genuinely have preeclampsia. They've got a name, they're called angiogenic markers, PLGF-like tests. And APEC, the charity we are involved with, have been pioneering getting it round the whole country. And the UK has actually led the world in getting this introduced as a new test. And it's very exciting because for the first time, we can have a confirmatory test whether you do or don't have this disease. And that is really a big advance for us in recent times.
Well, that's really helpful to have that information. And we can get on a bit later to talking about your work abroad and trying to reduce mother and baby deaths in other parts of the world. But Abbie, if I could just go back to you, and obviously having Jude taken to the NICU unit was certainly not what you were expecting when you first became pregnant. We did do an earlier episode in a previous series with a doctor from a NICU unit who talked a bit about the experience of having a preterm baby. So if anyone's listening to this and wants to have a really in-depth discussion about that, do listen to that earlier episode. But would you mind, Abbie, sharing what happened to you in the kind of neonatal experience and what happened afterwards?
Yeah, so I mean, the neonatal teams are just absolutely incredible. First off, the doctors and the nurses, the people down there are insane. And the things that they see on day to day, I don't know how they do it at all. So I take my hat off to them. They are incredible. Um, the neonatal experience is like a club you don't want to be in, along with the baby loss club that nobody wants to be in it. But it is that sense of community when you're there. All parents are going through the same thing there. He was in NICU, so he was in the intensive care unit, and there was, I think, 6 beds there. So all the other babies looked huge compared to him. Even when they were just like 3-pound babies, they looked huge. Yeah, it was a roller coaster of emotions. They were all very, very surprised that he survived an hour, let alone a day, let alone a week. So it was always very it wasn't a nice experience at all because you are just constantly wondering, is today the day? It wouldn't change day by day, it would change hour by hour with him. He'd have to try different medications, then you think he was nearly over it. You're like, oh, he's got an infection. And then it was like, oh no, his infection's a bit better now. And it was all about getting him off the machine, the oxygen machine, trying to get him off of that because he had that on really, really high. And the way they were going to try and get him off it was to give him steroids, but you have to be obviously very clear of infection to go on steroids. And he couldn't get clear of infection. And then the one day that they were like, oh, I think we can start him on steroids now, they did a blood test and saw that his liver was failing. And then his kidneys were failing. And then basically his whole body was just shutting down. So in the end, we were kind of it wasn't really much of an option, but I think they make you feel like it's an option. And it was like he's going to pass away, unfortunately, because if his organs are failing, he can kind of pass away in the incubator, probably today or tomorrow, or you can choose to bring him out and take the machine off of him, and he will die with you. So it's certainly a situation you never think that you're going to be in, but it's also one that I don't think I was aware at all how many neonatal deaths happen where actually you're choosing to turn the machine off. I think I just kind of thought that naturally, if they passed away in neonatal care, it's because they passed away from an event of, a cardiac arrest or something. But actually, I think quite a lot of the times it's the parents saying, like, okay, he's not going to get any better. I didn't want him to die on his own with loads of wires hanging out. So unfortunately, it was also the only time I got to hold him in the 4 weeks, almost 5 weeks that he was alive, because he was so poorly throughout the whole time. I couldn't really get to him. So yeah, we had him out for like kangaroo care and turned off his machine, and that's how he went. Um, so the whole experience was very, very up and down because there was little glimmers of hope throughout that whole time of like, he might be getting better, he might come home. And you also hear from the other nurses, like, stories of hope, babies that they've had that have gone through similar experiences, babies that have been on just as much medication or babies that have been just as poorly and have survived. So you do get those kind of glimmers of hope, but I think I always just kind of told myself that this wasn't going to end well and just kind of make the most of the time that I had with him. And I am grateful that I had that time with him. I got to know him. I got to know his little quirks. I got to see his long little legs and, I kind of got to know his personality as much as you can through an incubator. But I think I always knew it was going to end that way, unfortunately.
Well, Abbie, firstly, I'm so devastated to hear about what did happen to your son, and thank you for very bravely sharing your story. I know from reading all the comments we get in from listeners that although it's really hard to hear, it helps other mums to feel less alone when they hear about similar experiences to themselves. So thank you for coming on the show and sharing your story. And it must have been incredibly frightening after that experience to think about getting pregnant again. So could I just ask you about sort of pregnancy after loss? Because that is something that mums ask me a lot about, of the next step and how to process it. So what did you do?
Yeah, definitely. It is a terrifying experience to go through. And obviously straight after I thought, I'm not doing this again. But that thought obviously soon changes because essentially I was a mum with all this love to give and all this nurturing to give, but no one to give it to. So I did want to fill that void as soon as I could, but I did have to wait because of the cesarean that I'd had. So I think I was advised to wait about a year before trying, but I managed about 9 months and then got pregnant on the 10th month. So I got pregnant straight away. So getting pregnant wasn't an issue, which I'm very grateful for. But yeah, the anxiety that came with that was really difficult. I'd had a conversation with my consultant, the one who'd looked after me throughout Jude's pregnancy, about trying again. And she obviously told me then the devastating news that because I'd had pre-eclampsia, I would be highly likely to get it again. And I think she said I would be highly likely because depending on how severe you had it and how early you had it, kind of collates how much more at risk you are of having it next time round. And in her head, I had it very severe and I had it very early, the earliest that they had seen it really at that particular hospital. So again, I was kind of starting this journey knowing that I probably will get it again, but I was just hoping that I would get it on a little bit later and a little bit less severe, because I do believe that also I think that that's what the stats kind of say as well, that if you do get it, you often get it later and less severe. So I kind of clung on to that hope. I was very, very, very well looked after. I was monitored and constantly. My midwife was incredible. She would go to the doctors like before 8 o'clock so I could get my blood pressure checked before I went to work. Work were very accommodating. I was constantly being allowed to get out and, have my blood pressure taken and my urine checked. And I had growth scans every 2 weeks from 20 weeks. So I was in the hospital a lot, but that actually wasn't that anxiety provoking. That was actually more reassuring for me. I really liked that. And I just thought, all I've got to do is just this period of time. And if that brings a healthy baby home, then I'm happy to stay in here for 9 months. Like, I just wanted to make sure everyone was safe. So each growth scan was terrifying because I kind of went with this could be the time that they then admit me. So I had a hospital bag ready from week 20. Interestingly, they did do a test that I hadn't had when I was pregnant with Jude, because obviously I wasn't at risk then, that they were aware of. But I had a scan. Andy might be able to tell you more about this scan, but I had a scan, I think it was around 21, 22 weeks, that showed whether I was going to be likely to have a preterm baby or preeclampsia. And it actually did show that that was the case. I had what they call bilateral notching. So that then even cemented even further into my head that I wasn't going to get away with it this pregnancy. But I did. I did, and I don't know how. I don't know why, but yeah, I got to about 37 weeks, and my consultant was like, I think it's about time now that we just quit whilst we're ahead, because you've got this far, you've got no symptoms, baby's growing absolutely fine. She was like, I'm available in 5 days. Do you want me to deliver you? I was like, yes, please. And she came out and she was absolutely fine. So I didn't have to have any kind of neonatal stay. You are very anxious throughout the pregnancy, and I was very anxious once I brought her home as well. I was really, really worried about SIDS and falling asleep with her on me. I was terrified of safe sleep, but that soon went. Eventually went, but yeah, that's the experience for me. I'm very lucky that I didn't get it the second time round, but if I was to go on to have another, I would still be at risk and might not be as lucky next time. So it does change your future plans.
Well, I think you're also making a really important point here, Abbie, that although you had a really awful experience the first time round, you have now got a healthy daughter. And I think for anyone listening to today's episode to know that if you do want to extend your family, then, be aware of your risks, but also, do try again. And Abbie is a great example of a success story where she has now, expanded her family. So Andrew, what strikes me the most about listening to this conversation is, firstly, I really knew nothing about preeclampsia when I was pregnant and a new mum. But also, I really didn't understand the connection between having preeclampsia and potentially having an early birth and a preterm baby. So can we talk a bit about some really practical advice for mums then? So where can they get help and where should they find out some more information about preeclampsia?
Theo, can I just add to a comment from Abbie's last points, because I think they're very interesting. One thing we know about preeclampsia, it's caused because of a sort of a reaction between you and your partner. You have to sort of be together and tolerate each other, and that sort of is paradoxically the longer you are together, the more protective it is. So one of the major risk factors for preeclampsia is your first pregnancy. So second pregnancies are safer, and many women, you can imagine the story Abbie tells us is just unbelievable in terms of a life event, and having to face up to that again is really, really challenging and difficult. And you can imagine a lot of people don't want to try again. The fact is that if you try again, more often than not, you're going to be okay, even if you have devastating early onset preeclampsia like Abbie, because of this reason that subsequent pregnancies may not be as bad, and because people are looking after you and doing things to make things safer and better. So I just kind of want to reiterate, one of the stories I often get from women is, oh, I can't possibly try again, this is awful. And we say, I've never regretted saying to a woman, I really think you should try again if you want a baby. And that's a really important story. You ask about kind of where to go. The charity that we both work with, Action on Pre-eclampsia, is dedicated to women primarily, and also, all stakeholders relevant to the disease, in helping them in all aspects of knowledge and coping and everything else. And there are fantastic information resources available on the website, and I'm sure we can share that. This is one condition where things go wrong, they're nearly always avoidable. That's the problem. Not always, and I suspect in Abbie's case that even if she was picked up and didn't have serious problems, the outcome may not have been different if it had happened earlier. But with these new blood tests and with our knowledge, we can make a big difference. And I think you were alluding to the fact that, we try and take this elsewhere. One of the things about the UK, although there are still devastating events all the time, we are doing pretty well because of our NHS and because of our kind of free at point of care access, because everyone can get their checks if they turn up and ask for them. They can get their blood pressure and their urine. And on the whole, the outcomes in somewhere like the UK are probably some of the best in the world. And I think sharing this sort of podcast is a really critical part of what we do, making sure women know about the disease, know what they can do, and what advice to seek, what checks to do, what to look out for, are real lifesavers in themselves. And the charity is there to help, and people like Abbie, and I agree, is unbelievably brave coming and telling her story, but boy, it does make a difference to other people. You're right.
And it's actually really helpful to hear what you just said, Andrew, because I don't want this to be, a podcast which is depressing to family. It's here to be helpful, to say, these are things which are avoidable and things where we can actually make the difference by giving you this information. So, Abbie, you are the front line. You are the person answering the phone call if they ring.
Yeah.
So just explain the process. If a family listening today wants to get in touch and is worried about preeclampsia, what's the first step? What should they do?
Yeah, I would say in any step, if you are worried about anything when you're pregnant, then you need to go get seen. If you've already got to the point where you're thinking of ringing the helpline, then of course ring us. But the first thing I'm going to tell you to do is get checked by a medical professional. I think there's a lot of weight to be held on women knowing their bodies and trusting their bodies and their intuition. And I genuinely believe that mum knows best. So really advocate for yourself, and partners should advocate for you as well. I think, don't wait. Lots of people will say to me on the phone, I've got a midwife appointment in a few weeks. Shall I bring it up with them? No, go get checked now. Go get checked now, because they would much rather see you now than see you in 2-3 weeks and give you some devastating news because you didn't go in. So 100%, if you are at the point where you're researching preeclampsia and you want to give us a call, please give us a call, but please also arrange to go see somebody. So whether that's going to your GP or calling into your triage, like your maternity unit, whatever access you have, you need to go and get your blood pressure checked. You need to go get your urine dipped, have your movements checked, have baby's heartbeat checked, have all those checks done, so that you're safe, basically.
Yeah, that's really helpful. And there's a link in the show notes today to the fantastic charity that both of my guests today represent. So do take a look at their hotline and get in touch. And Andrew, just listening to what you were saying there, we are incredibly lucky in the UK that we do, of course, have a National Health Service. I'm aware that it obviously has significant pressures and we have challenges with fragmented care, but we do have a basic level of primary care in this country that a lot of countries would be delighted to have anything remotely similar. So you've done a lot of work, I know, in Africa, in India, and in South America. And I know you've done some global research into reducing kind of mum and baby deaths, and that's something very dear to my heart. And I'm keen to continue campaigning at kind of global level to make sure governments are prioritising and funding this. And that's why I set up the Global Birth Trauma Alliance to kind of bring politicians together who also care about this issue to be making the case on the global stage. So could you tell us a bit about your work on pre-eclampsia internationally, and what can we all be doing to sort of advocate to get this on national governments' agendas?
Yeah, no, thanks for the opportunity, Theo. I'm passionate about it because it's such one of those inequalities that shouldn't be there, and can be reversed literally overnight if we just did the right things. There are so many bad things in the world you can do nothing about, but I really believe this is a relatively quick win. I also want to reiterate, that it's true we are taking the strain in the NHS, lots of unhappy people and so on at the moment. But I will reiterate the fact that appreciate what you have, because I'm fortunate enough to go all over the world seeing what care is like. And we actually have excellent care in the NHS, and it is still excellent with excellent people. And we shouldn't lose sight of that with all the apparent unhappiness and all these kind of reviews about maternity and all the rest of it. That I think it's fair to say that the mortality in the UK from preeclampsia, I think, is the best in the world. We are like, you're 15 times less likely to die from preeclampsia in the UK than in America, and they spend a lot more money on healthcare because of this lack of inequality. So that is a really good news story. That said, if you go across to Africa, you are literally up to 1,000 times more likely to die from preeclampsia, and it's avoidable. So we've dedicated a lot of time just doing really basic things like getting blood pressure machines to rural clinics. And we're even introducing this new blood test in a very cheap, simple point of care way to kind of Africa, as it were. And if that works, the paradox is it'll come back to London and people will have quicker access to good tests in London as well. So, I mean, you can read about it, on the website. APEC International is linked there, and it tells you about the work we're doing. But, as I get older, I really want to do something worthwhile, and I can't help thinking this is a quick win. You really can change lives overnight with this problem. Preeclampsia shouldn't be dangerous, and simple things make a big difference. That is really key.
Well, that's so interesting to hear that. And I remember when I was a Member of Parliament on the International Development Select Committee, we would hear some really shocking stories about the lack of access that mothers had to maternal health care. And I visited myself a lot of countries in Africa in particular. I remember going into a neighbour ward in Sierra Leone and seeing the complete lack of resources that they had if anything went wrong, and how incredibly dangerous it was. So we are very grateful to our NHS staff and for what they do. And rest assured that myself and other campaigners like Rosie Duffield MP will be keeping up the pressure on the government to be pushing for more maternity care in countries in the UK and around the world. So
and
that leads me...
Sorry, I was going to just say the NIHR, which is obviously our government fund, have actually just funded a large project that has scaled up blood pressure devices in every single 2,500 care facilities in Sierra Leone. I think it's a bit tragic that, FCDO and so on are having these cuts, because these cuts, because of the climate in the world, really are going to impact not so much on us, but on Africa. It is a tragedy, when we start paying money in other places, we take it away from really good causes.
And no, I very much agree with you, Andrew. And I was always a big advocate as a politician for our overseas development budget for exactly that reason, that I think we have a sort of moral duty, I think, as the UK to help other countries around the world. But also it's a really vital tool of our soft power to help other countries. So I very much echo that. And perhaps a topic for a future episode, we could look at sort of maternal healthcare in other countries. And we're coming towards the end of the episode, and I always like to ask my guests sort of two similar questions. And the first is, if the Prime Minister or the Health Secretary was listening to today's episode, and we know that politicians are listening to Breaking the Taboo, what would you like to say to them, and how can they improve care for new mums and deal with issues like preeclampsia? And perhaps, Abbie, I'll start with you as a mum.
Yeah, I mean, I think the biggest thing is to get the PLGF test in all the hospitals. That's the biggest thing that we're campaigning for at APEC. Our CEO, Marcus, is quite good at his political lobbying, and has managed to get Scotland to promise to get it into their hospitals. So there is still some hospitals in England that aren't doing it. So I think that would be my point of conversation there, is everyone should be able to have access to the PLGF test.
Very good suggestion. And Andrew, what would you like the government to do to improve maternity policy?
Well, trouble with a single disease is people are always going to harp on about their disease. So it's a tricky one. I think the government have a very hard job. I think to appreciate people, okay, appreciate the NHS staff, make people feel loved. The thing that's changed in my lifetime is not the workload; it's the happiness of the staff. And I think people do work very hard. The vast majority of people work very hard, and they find it very hard to face criticism. So some way of nurturing the support, and you'll find people will work better and more efficiently. That would be my plea.
Well, I think that's such an important point, and something we've discussed in the birth trauma inquiry when I chaired it in Parliament last year was obviously burnout of NHS professionals. And, you as a mum, Abbie, are going through an awful experience, but imagine seeing that day after day, and some of these nurses and doctors seeing very traumatic experiences on the front line as part of their day-to-day job. And I think government really has a duty to look after our NHS staff better. And it links to that wider point, Andrew, you were saying about globally as well. I mean, some of the places I've been to in places like rural Kenya, I mean, we take it for granted that you probably do have a GP on your doorstep, but imagine walking, 3 days to get to your nearest hospital and being told they don't have electricity and you can't have a C-section and your baby's died. I mean, that's the frank reality for many mums. In fact, Andrew, you should take a look at my book where I have some stories in Breaking the Taboo of other stories of global birth trauma around the world, where we look at exactly that issue. And I think that would be a good topic for a future episode. And finally, I'd just like to conclude the episode with some really practical advice for families listening. So starting with you, Abbie, is there one piece of advice that you'd like to signpost anyone listening today to? So it could be a book or a podcast or a charity or anything that helped you that you would like them to look up.
I would say action on pre-eclampsia. I know I'm biased because I'm there, but please just ring me, email us if you're not confident on the phone. You can email us. We have Instagram and Facebook. We're APEC_UK on Instagram. Send us a message there. We're more than happy to speak via messages or on the phone to just give you some advice and to just kind of give you that confidence to listen to your body and get checked.
Yeah, very good advice. And Andrew, what would you like to share?
Yeah, I mean, I have to say the same resources. I will just add to that. Don't be frightened to advocate for yourself. Ask, know what you should be having. And if you're not getting it, insist you get it. I mean, that's going to be safe in this area.
Knowledge is power.
And I absolutely agree with both of you. And we've heard this time and time and again on the episodes on every topic, whether it's miscarriage or it's group strep B or any of these other issues, that, I think mothers know their bodies best. And if you feel something's wrong, then you should pick up the phone and you should ask for help from a medical professional. Well, I'm afraid we've come to the end of today's episode. So can I firstly thank my guests for coming on today to talk about pre-eclampsia. I certainly learned a huge amount about this issue, and I hope that you did too. And if you're finding Breaking the Taboo useful as a series and you'd like to share this episode and others, please do with friends and family. We want to reach as many people as we can. And do also rate us on iTunes and Spotify so that as many people as possible get access to the help that they need. And don't forget to get in touch with us if you have ideas for future episodes. We do read all of the comments that come in from you, and topics like today came about because of seeing what listeners wanted to learn more about. So thank you for listening to today's episode of Breaking the Taboo, and stay tuned for next week's episode. Bye-bye for now.